It is now my privilege and honor to introduce our speaker for today. He's no other than Dr. Pedros, the Executive Director of Hydrochrome Limited. Dr. Petros is an accomplished professional in the wash sector and has been working with Hydrochrome Enterprises, which is a company specializing in consulting services and information technology, and is based in Cyprus. He's got many years of working, including in Africa and more than 30 countries throughout the world. He's a project manager for the Edams line of products and IT solutions. Dr. Pedros is also an author of more than 70 publications in the field of water supply and utility management, and is regarded as an authority in the field of utility asset management. Dr. Pedros, welcome to this webinar.
Thank you very much. Thank you for your nice words in the introduction. Good day to everybody. My name is Dr. Kolovopoulos. It's a difficult name. Petros is easier. So I'll forward a bit the presentation, and I will start by saying a bit of background, where we are, where we're coming from, how the Edams software evolved, where we have implemented the systems. So I would give a short background for the Edams software. Then I will try to define the problem, explain how do we see the problem, what is on-site sanitation and sludge removal, what is the software can do for that, how the software for water and sanitation can be applied to off-site sanitation, what functionalities we have, what's the problems with fecal sludge management, how do you do the monitoring and evaluation of these procedures, and finally, what is the proposed approach and how do we see the way forward. I will start by giving a bit of background for the Edams systems, where we're coming from. So we as a company, we specialize in three main sectors. In technical systems for utilities, in asset management. We have implemented for more than 10,000 kilometers of section networks. Then billing systems, we have systems implemented in the order of millions of connections, and for government solutions. Our customer base is all over Africa, particularly Southern Africa. We have systems in Lusaka, in Ghana, in South Africa, in Umgeni, Solplaite, Siza, Silu, then in Swaziland, in Lesotho, in Botswana, in Blantyre. I would say in most of the countries in Southern Africa, the Edams systems implemented. But also in the Middle East, with particular emphasis in Egypt, where we have an installation base of more than 30 million population being served. And in also some installations in India and in some in Balkans. In total, more than 250 utilities and more than 1,000 users are currently using the Edams systems. And that gives us a very large insight in the procedures and the ways that we can more quickly customize and implement the systems in a utility environment. When we're speaking about Edams systems, essentially we're speaking about utility billing and CRM, asset management, operations management, licensing and permits, quality monitoring, evaluation and LIMS, and utility business intelligence. Just a quick example, Edams systems in Egypt. Egypt is divided in governorates. We serve more than half of the governorates, and currently we're responsible for billing and technical systems of more than 40 million people in Egypt. So I'll start by explaining the problem and defining what the problem is with on-site sanitation. So for starters, many on-site sanitation systems and fecal sludge systems have been documented worldwide. I did quite a comprehensive research on publications on on-site sanitation, trying to understand what exactly is the problems, what exactly these systems face in terms of management, in terms of operations these systems have. I was surprised by the fact that not enough is known about many operational aspects of these facilities. As an example, it's not enough known on the type of sanitation systems and other factors associated with the emptying and the transport. So what is the influence of the on-site sanitations on how the facility are emptied? And what's the effect of release of fecal on the environment during emptying? It's a very interesting study I actually came across. I have the reference on the bottom. Very interesting study that came across in quite a few Asian countries. There were quite a few number of peer review studies that they identified that very few information exists on the pathogen releases and fecal sludge during emptying of these facilities. Another interesting issue is that in just over half of the surveys, the majority of the households surveyed, they never emptied the on-site sanitation facilities. That's very, very interesting concept. And when they tried to relate, when do they actually empty the on-site sanitation? What was the frequency? They found that it's very much sensitive to the cost, to the accessibility, and the service quality the utility provides. Now, please note this concept that the whole success of on-site sanitation is based on regularly emptying these facilities, on getting the cooperation from the communities, and managing the fecal sludge systems. And we find, all right, this is in low middle income Asian countries, but the pattern is that the majority of households surveyed, they were not actually emptying these facilities, and they were very affected by the cost and accessibility to them. So after quite a bit of research and trying to understand the problem, we identified that the main issue is that on-site sanitation operations need to be managed, need to be properly managed, including the whole process of installation of on-site sanitation, of usage, and of maintenance. In addition, it's very important to have accurate estimates for the volume and composition of fecal sludge produced in an area. In essentially, is the only way we can properly size the infrastructure required for the collection and transport networks. That requires that we quantify and characterize the fecal sludge. To do that, we have to have effective field monitoring. So we should be able to monitor the on-site sanitation with appropriate field tools. And that's the only way we can protect the water resources at the same time. One thing that has to be monitored is the contaminant levels. So we have to know what's the effect in the water resources in the water table and what alternative sanitation strategies have to be implemented. Without field monitoring and proper management of on-site sanitation, that cannot be achieved. That also means we have to operate the fecal sludge systems. We have to operate the emptying, the licensing, and manage the operators. All the above will enable us to implement policies and rules. So we will be able to take into account all the different variables that influence potential environmental effect of on-site sanitation and assess the risk of pollution of water resources. And last, but perhaps the most important, we should be able to communicate with information to communities. Communities is our partner, and they are decision makers. They're the ones who decide when to empty these facilities. So they have to be on board. So with on-site sanitation, the communication and providing online and appropriate information to communities is very, very critical. So all these points that are listed here, from our point of view, are the main issues for addressing the problems with on-site sanitation and fecal sludge management. But that contradicts a bit the title of today's seminar. The opening slide speaks about tools. Tools refer primarily to issues like planning. You can use tools to plan. The systems I'm presenting you today, they're not just tools. They're operational systems in a utility environment. The solution to the issues we're facing on on-site sanitation cannot be addressed by tools. They can only be addressed by operational systems within the utility environment, and that utility must be properly empowered with a proper capacity development program to be able to address these and managing these processes. Everything I'm saying is aligning with the United Nations Sustainable Development Goal, number 6, which actually emphasize that our main goal and objective is to prioritize evidence-based sanitation interventions to achieve and maintain universal, equitable access to safely managed sanitation. And for that, we have to understand the impact of sanitation and sanitation interventions on health outcomes. So the critical work here, the critical word is evidence-based. We need to have the evidence, we need to have the facts, we need to understand the process to be able to take these decisions. And towards that, the suite of I'm presenting you today, and it's part of Edams. The objective is to enable proper on-site sanitation facility delivery and proper procedures to operate and manage the fecal sludge removal, the fecal sludge management process. So setting up the Edams systems for monitoring and evaluation will manage and monitor the intervention process and their effect, including operational monitoring, environmental health monitoring, health impact, and institutional and organizational performance. So end of the day, we need a monitoring evaluation system to be able to understand and monitor the process and the health impact in the environment. Now I will give a bit of introduction to the Edams software for water and sanitation and how this software have been adjusted to cope with on-site sanitation. In a utility environment, the main set of software being used is what we call ERP, and it's a financial software. It's a collection of modules covering procurement, stores, human resources, support services, financial asset registry, budgeting, all the financial modules essentially. But at the heart of the utility, what normally exists is the main data management system, the main database. These databases, they handle two kinds of information. First, the commercial data, all the commercial information, the connections, customers, properties, and the infrastructure data, or anything that has to do with your networks, your actual infrastructure, and then any other related special data sets. All this collectively is your main central database. That is, for us, we call it an Edams database. It's a collection of all this information. And this database has evolved over the application of the last 50, 60 utilities that we find commonalities and we develop that structure. That database management, that data management systems enable us to perform two main functions, asset management planning and network modeling. Both of them for planning purposes. Together, they form what we call asset management. And it's the heart of a collection of modules for asset management purposes. At the same time, there is another system, Edams system, responsible for any kind of maintenance activity within the utility. The maintenance infrastructure involves different modules. Two of the most important one is the call center, and the other one is the field work management. The call center is to be able to communicate with our customers or with anybody who wants to contact the utility, either directly through phone or through any social media interaction, any kind of Viber or WhatsApp application on any other social media system that used today. And field work management are the tablets and the mobiles that are going out are employees of the company to execute any kind of maintenance work. Together, these systems, they form the collection of modules forms what we call maintenance management. And then there is the other side of the story, the other side of the utility that handles anything that has to do with billing. Our system is called Billing and CRM. Essentially is a system that manages not only the billing part of the process, but primarily the customer services side, and also involves a customer portal and a mobile application, field work management, meter reading, interfaces to payment APIs, to smart meters, and so on, and a collection of other modules. All these modules together form what we call commercial management. And then we're coming to the heart of the technical services of the utility with systems called operations, and they manage any kind of work the teams do on the field, like getting readings from the bulk meters, taking measurements from the field, and also includes a very main component which has to do with water quality monitoring and evaluation, linking to the laboratories and establishing a laboratory information system, and again has a component that has to do with fieldwork management. Together with that, there are systems for non-revenue distribution management and commercial data evaluation. Operations is a collection of various modules performing any kind of work within the technical departments. All these subsystems form what we call operations. Now, we took some of these systems and we put them together to be able to address on-site sanitation. So the systems that we included in on-site sanitation
Hi, Dr. Petros. Your mic is
yes.
muted.
Yes. Okay, can you hear me now? Yes, sorry. So all these subsystems, the maintenance management, the operations, the commercial management, the monitoring evaluation, form what we call Edams on-site sanitation management system. So I will discuss now the main aspects of implementation of these systems and capacity development issues. Now, as I said earlier, the Edams software for on-site sanitation enables utilities, municipalities, and governments to first manage the on-site sanitation facility delivery, operate the fecal sludge management systems, and set up business intelligence and management reporting. These are the three main objectives of creating and putting together the on-site sanitation software. How do we go about it? We go in a phased implementation. It's a phased implementation and a capacity development program at the same time. And it's done in 3 stages. We build that after doing similar programs I was mentioning earlier, together with GIZ for asset management. Then we educated also ourselves over a period of 5-6 years, implementing a program called SIAM in the Balkans, where we understood exactly how do you build capacity within the utility and how do you phase properly an implementation. So with that experience, we formulated this program and we phase it in 3 stages, and at the same time making sure we build the capacity within the utility. So phase 1 is creating the Edams GIS Edams database. So that database exists. That is built, it has all the right information built in already. But what is important is to link with all the existing sources of information within the utility or outside the utility. So first of all, we have to make sure that we link with the cadastral and property information. We cannot effectively manage the on-site sanitation facilities if we don't give them a geographical substance, if we don't know where the properties are, if we don't relate to the properties. So we have to create a property database, and that has to be linked to other external agencies for regular updates. And at the same time, any existing external on-site sanitation data, we convert and we validate them. And by validating them, we include in our system any kind of additional fields or data and accommodate any other existing information already captured. So stage one is to establish the main registries and link to the existing on-site sanitation data. That is a most important phase because that formulates the base where we know that we don't any kind of work already existing and any kind of data that already exists, we incorporate into the system. Phase two is we become operational. Now, once we have created the base and we have fine-tuned our Edams database, then we come to the phase we can actually deploy all our systems and become operational and manage the process. When we say become operational, essentially we discuss, first of all, implementing Edams billing, utility and billing and CRM. So by implementing the CRM, we manage the on-site sanitation delivery process. At the same time, we manage the charges for the on-site sanitation delivery process. If there is an existing utility billing, then we link to that billing and we let that billing do the charging, or we doing it depending what it is. In the many utilities we have actually in the Southern Africa that we have implemented our billing system, then that process is seamless, is the same system. And at the same time, communication with the customers is of paramount importance. So we make sure the call center becomes active. So any kind of call can be forwarded immediately to the maintenance. We make sure that the customer mobile application is there. So the customer can communicate effectively with the utility and either to complain or to ask for the on-site sanitary facility to be emptied, or he has to pay. So any kind of interaction regarding that to be as easy as possible and as seamless with the community. And at the same time, regarding the fecal sludge management, we make sure that by having the Edams maintenance systems and the Edams operation, any kind of applications for emptying on transport license or treatment operational license, all this information are captured, and all the process of the emptying is monitored by the maintenance management system, so we know automatically what is happening on the field. And the last stage of phase 3 comes after the operational system is being used, and essentially is now in a position to release our management portal. But the management portal is the one that puts together all the information, all the statistical information, all the collective information we have, and making them public, either to the management or to agencies or whoever has to have access to this information and the statistics and the portals and all the dashboards that have to be there. So the monitoring and evaluation portal is the one doing all the performance indicators, doing all the charts, all the graphs, and all the other information that have to be collected. We already have a utility portal that contains more than 150 standard dashboards that can be used for different purposes, and that can be customized for this specific applicability. So what are we talking really is a 3-stage capacity development program. Stage 1, or silver stage we call it, we're establishing the main registries and links to existing on-site sanitation data. We assist users in setting up and maintain validated registries by systematically mapping all processes and establishing a validated data repository. Stage 2, where the 2 processes are fully operational, we enable users to improve productivity and efficiency and delivery with the maintenance function. And stage 3 is where we enable users to fully integrate all the systems for planning, monitor, and reporting purposes. So it's a 3-stage capacity developing, building properly, and capacity within the utility to accumulate and connect to all the sources of information, to make all the processes operational, and be able to produce all the right indices and all the right management and monitoring information. So this 3-stage program, which we implement and through setting up the systems on the cloud, all the systems can be used and can be deployed in a very little time. So we believe one stage to the next can be deployed in anything from 3 to 6 months, depending if the customer, what capacity he has, what system he has, and how large or how difficult is the implementation. So I will mention now a few things about more specific details and examples. What functionalities the on-site sanitation system has. I will present also some examples, how the system works, and what actually functionalities are being used. First of all, as I said, for the database management and the data conversion, all information on properties will reside on Edams commercial database. Any kind of additional field will be custom made, and any additional fields will be accommodated, like status, certification, and so on. Any kind of data from external database will be imported. The important thing we have to say here that this OSS database will be the custodian of all sanitation delivery process data. This will become the main database that will concentrate and accumulate all the information for on-site sanitation. Modeling the delivery process and taking over the delivery process will be done with the Edams Billing CRM module. Now, we have a CRM module that can actually be easily, without no development, by users customized to represent 100% the process they use for OSS delivery by the utility. Like you see here, you can select a customer, can check with the employee checks if the property exists, what consumption category he is. He can locate exactly on the map where his property is. He can issue invoice for sanitation fees. He can collect the charges. He can set up appointment to confirm the construction. He can investigate the outcome. He get approval for sub-finance to send a job card to the contractor, and the contractor completes the work. So that's a sample way how the user interface to handle the on-site sanitation. How do we do that? We have something called application designer. The application designer is a standard component that made customizable application made from standard building blocks. So we have all these building blocks like find property, issue invoice. We put them together in any order we like, and very quickly we can design flexible workflows that can match any business process. And in this way, we can define unlimited types of applications. So very quickly, by requirement definition of how the utility does the on-site sanitation process, we can map exactly the same process on how the system should work. And depending who should have access, we can empower each step, who should have access to this step, and who should execute it. So when a customer comes to the utility and he sees his customer details, the employee can immediately select the application type he wants to execute. He can create the customer application and follow exactly the workflow that has been designed for. And as part of that workflow, he can ask him for all the right information, step by step. He can issue him an invoice or an application form. And the most important, he can store in the system, like a document management system, any kind of information that he needs. And any kind of email and confirmation can be sent through the email directly back to the customer. So all that information I showed you can be simulated, can be customized for the utility in the minimum of time using the CRM, which is built into the system. But what is also important is the customer interaction. Customer interaction in the OSS management process can be used for creating demand, promotions, and information. for application for registration for the on-site sanitation facilities, and also for charging through the delivery process as per the agreed terms. And the customer interaction is primarily driven by the customer portal and the customer mobile application. That's an example of the portal that's being used. Is all geographically referenced, and you can see immediately where in the map is his property, so you can see exactly the whole area with all the OSS facilities which in the region. And a typical process is we can have a complaint type of application. The employee can see all the outstanding applications, which ones have been executed, which ones the teams is at the field. So there is what we call back-to-back interface. From the portal, you can see immediately at what stage a specific job or specific work is being executed. And he can see from the complaint, you can send immediately a task assigned to the field work, so to see if the work is actually being executed. And again, once the customer portal closes a job, you can send feedback via email or text message back to the customer. The field work management, again, for the commercial management, assists for capturing of property sanitation facilities, for capturing new property information, and supports the OSS delivery in all the required steps and activities. Again, an example showing different type of applications. In this specific case, the fieldwork management is used for another application, the utility for maintenance or for disconnections, and so on. And this is a typical example for OSS functionality. I'll discuss a bit shortly some specific application also for the fecal sludge management. Fecal sludge, as we understand it, is the storage, collection, transport, treatment, and safe end use and disposal of fecal sludge. The processes which are fully incorporated in the Edams systems is the management of the emptying process, is the licensing of the operators, and management of the operators' work. Emptying management it's fecal sludge can be done in two ways. It can be done on a scheduled basis or an on-call service. This is on demand. This is driven by the customer. But it also might be out of a pre-planned program in an area from certain activities. So you need to be able to respond to both kind of activities. So the emptying can be manual, mechanical, and also you have to account for all the sludge being carried to the treatment plants with a vacuum trunk, a pump mountain, a small tank by a motorcycle, or other means. So all these activities of the operators should be modeled and should be able to control and monitor to allow both on-call services and scheduled services. The Edams MMS is used for that setup and provides the functionalities and to the utility employees and the contractors to support and monitor the emptying process. Don't forget, as I mentioned at the beginning, the emptying process of the facilities is very, very important also for environmental reasons. The monitoring and getting field measurements at the emptying process and also at the site of the OSS facilities and where the sludge disposal is critical to understand what happens in the environment, how the water resources are affected, how the water table is affected. So there's a very serious health component here. And it also has to be considered that without proper monitoring of the operators and without proper site work and field work to be able to get the required environmental data in all these sites, we're not going to have enough information to take informed decisions. How do we plan these activities? So one application that we find very, very important to be able to do that is to get the customers involved. So customer interaction in the emptying management process is critical. So the customer should be able on demand to apply at any time in the easiest of ways through the mobile application by calling the call center or going to the utility branch office. Towards that, we have designed a very modern mobile application that can do a lot of activities, submitting from applications to complain, submitting any kind of readings, uploading any attachments. He can see at real time the status of his application, exchange messages or attachments through the Edams portal communication. He can actually report a problem. The system automatically log his current position of the user on the map, allow to mark the exact problem location. He can describe any kind of incidents that might happen. He can identify and merge incidents and report for the same problem, and notify the system, the customer upon problem conclusion or problem resolution. Another side of the fecal sludge management is the licensing. Now, licensing is because we're dealing a lot with government departments. Licensing is a big part of the modeling and the services we're providing. So we have designed a dedicated CRM application. We call it a licensing module that covers the full circle of a licensing process. So when you're licensing, you have facilities, operators, or customers. You have application, you have inspection, you have licensing, you have history, and you have monitoring. This is a cycle that you have to be able to cover every time you consider or licensing somebody. There's no point of licensing anybody if you cannot inspect him and if you cannot monitor him. You must always remember these two aspects. So particularly operators for fecal sludge removal, they have to be permanently monitored and inspected in regular intervals. So 3 types of licenses are normally required: emptying and transport license, treatment operator license, and reuse operator license. All of them need to be controlled and need to be monitored. So the Edams licensing and permit system provides this functionality for managing the whole process, from the licensing, history, monitoring, inspection, and starting from the application. And in addition to the actual system, operation management covers 3 parts. First of all, creates records, logs. So fecal sludge management for treatment and reuse, any kind of records that they keep can automatically logged into the system, like volumes, like parameters, quality parameters that have to be monitored. Then inspection data to ensure quality of service, like equipment, vehicles are in good order, that records are kept, and so on. And also any kind of charges, accounts, any kind of payments that have to be handled. So operator management in terms of these 3 aspects is very important. That's part of a screen from the licensing. You see here a specific customer which been managed. These with red are all the outstanding inspections, and you can see that not outstanding, these inspections that somebody went out and the inspection failed. So they're highlighted with red, and some action has to be done by an employee or a manager to address why this inspection actually failed. The whole process of simulating the licensing is done with the same CRM module I mentioned earlier. Again, you have predefined steps that can be customized and can be monitored. And again, there is a whole set of reporting to be produced for inspection and permit status per area, per region, per operator, and so on. So licensing and permits, it's a important part for proper fecal sludge management, and that implies proper operation management. The same goes with together with that, as I mentioned earlier, is the field work management. I showed you examples earlier for OSS. The same system is used for the fecal sludge removal. And another part, very important, with the quality data collection. In many cases, we're dealing with environmental data that have to be collected from the field. So the portal can handle any kind of quality data collection, which is absolutely necessary if we want to quantify and characterize the fecal sludge. So the portal needs to be able on the site to collect environmental data and to collect quality data. That is essential part of building proper information to manage health issues. Another aspect I can also discuss is the billing side. For utilities that have our billing is not an issue. For other utilities, the charges can be passed to the customers in their own billing system, or if not, the charges and the payments can be managed directly by the system. And so charges for any OSS delivery process or any sanitation levy or emptying fee, any customer payments can be enabled through the Edams billing CRM and the customer portal. I won't stay into that, but there's a whole process for managing any charges and payment. Can be scheduled as a batch process or any other cycle or any other flexible periods or ad hoc and so on. And last, but perhaps the most important, everything we're doing, everything we discuss up to now is operations. It's not tools, it's operations. We build capacity in the utility to manage properly their operations. That is all about. If you do that properly, then you enable monitoring and evaluation. Then monitoring and evaluation becomes natural. And monitoring and evaluation is effective management reporting at all levels. These days, this reporting is more in terms of dashboards. And these dashboards have to do with different levels of reporting, either operational reports or consolidated management reports or departmental reports. And reports have to be structured in such a way to instigate corrective action. Like you seen earlier, the inspection failed, something must happen, some corrective action must occur. So that's the kind of reporting that needs to come out of the system. And the management reports and the dashboard must always be able to calculate the key performance indicators. Must be drillable and must depict all these performance indicators and consolidate them at different levels. This is an example of a utility portal. This is a real portal used by one of our customers. You can see here that there is parts which is an executive dashboard with status, performance, summaries from the maintenance department, from the commercial department. Then there's a section with customer information, analysis of consumption, actual consumption versus projected, revenue management, different summaries for the sales, for the revenue, for customer charges, and then operational reports from the operations, monitoring, performance analysis, maintenance summary, maintenance management complaints, faults, investigations, reactive maintenance, planned maintenance, and so on. That's a typical portal that the manager is able to see on his computer or on his mobile. It's a collection of reports, a dashboard that produce all the necessary M&E that needs to be produced. A lot of this information comes from the maintenance system. The maintenance system, I would say, is the most critical for building up that M&E information, because that provides the core for all the problem log, all the plan activities, all the job card information, and all the work order management. By having proper work order management, you'll be able to get all these utility management information. And you're getting different management reports, either it's in the form of a table or it's the form of a crystal report or some other reporting. But most important, you're getting a lot of dashboards. That's a typical revenue billing and revenue management dashboard, which is drillable. You can see specific customers per month for the whole year. You can select which period you want to see. You see aggregated data and so on. So dashboards are very much more and more being used as M&E more effective way of communicating information and producing summary information. So these are all the components and all the complexities of the system. We come to the last section, which is, so what is the proposed approach? How do we go about it and deploy these systems? And a bit of a summary about the implementation. So a possible implementation, as I discussed earlier, first of all, always has a requirement definition has to happen to understand the players, to understand who holds the main information right now, who currently collects all this OSS information, methods of collection, frequency, where is the property databases, the stakeholders, matching of data. But this is a package requirement definition that normally is executed in a very short period. And then there is the data collection process to actually computerize and set up, and the fieldwork management and the actual other applications. To set up the implementation links to the different existing utility systems. As I said earlier, for Edams users, this is the easiest step. To set up the manual input, which data has to be inputted manually. And the main thing here is that this kind of software is most easier installed on the cloud, and we have an appropriate licensing structure. So in essence, the customer doesn't purchase the software, it just pays an annual fee for the use of the software. And the information he gets out it, the nice thing about it, by setting up on the cloud, with the permission of the utilities, summary and consolidated data can become available to agencies to optimize the OSS and FSS processes. That's very, very important, because by setting up in the utilities the operational systems and consolidating this information for all the utilities in the same place, we can provide a different set of performance analysis and M&E reporting to different agencies. And that is really reliable data coming from the actual information in the utility level. So in summary, what I just described is a 3 stages capacity development program that includes establishing the main registries, making the systems operational, and then managing the whole process through M&E. These are the 3 stages, and effectively what we managed to do is deliver and have a system to manage on-site sanitation delivery, operate fecal sludge management, and set up business intelligence and management reporting. As I started at the beginning of my presentation discussing the problems, I believe that we might, with these systems, not achieve all our targets, but we expect a proper implementation of these systems to have substantial benefits for the utilities and the agencies. So these are the objectives we're really achieving. First of all, we manage on-site sanitation. We enable field monitoring of the on-site sanitation schemes. We operate the fecal sludge management systems. With the proper information collected, we enable the implementation of policies and rules, taking into account all the real information and the multitude of variables that influence environmental effects. And last but not least, perhaps the most important of all, we establish proper communication with the communities and interacting with these communities to become part of the equation. And we enable them to make informed choices and decisions and to address problems and incidents. Thank you.
Yes, thank you so much, Dr. Petros. I think that was a very wonderful presentation on the whole on-site sanitation system as well as the fecal sludge management. I think before we go to the next agenda item, I'd like to give you just 5-minute break so that you can stretch. I know there's a lot of information to take in. A lot were discussed, demonstrations were made. So we just use this 5 minutes to kind of reflect, and then as we go into the other part of the presentation, which is the Q&A session. So we can just have that. I'll put a timer on the screen, and then we can start that session. Okay, thank you very much. I think we are just at the right time, 5 minutes past the break. I hope we are back seated on our seats. So for those that join us as we along the way when we started the webinar, we want to apologize for the inconvenience. We had some technical issues at the earlier start today. So apologies for any inconvenience that might have caused. So we just finished this session with Dr. Petrus walking us through the entire Edams system. And right now, we'll just start with a Q&A session. We have two options. You can drop your questions in the chat, and I can have Lola read out those questions to you. Or you can just raise your hand, and then we can unmute your mic for you to ask your question. So Lola, please just let me know if there's any question in the chat.
Okay, someone had mentioned if we can start off on the on-site sanitation systems.
Yeah, so I know earlier there was a question from in the chat. You were asking about, some details about the on-site sanitation system. Probably if Dr. Petrus can give more clarity on the solutions that exist for on-site sanitation. And then before we go to Inamaka, I think Inamaka has her hand raised. But we can just address Kao's question. I'm sure her name is Kao in the chat.
Can you be more specific? Can I repeat? You'd like me to repeat for the on-site sanitation and say a few things again, or what? Or is more specific the question?
Yes, just currently, are there solutions for on-site sanitation? If there are, could you give some specific examples of what kind of services or functionalities are currently available for utilities to manage OSS?
Well, from our survey, utilities, each utility does its own thing. There is not an off-the-shelf standalone solution we have seen around. We have seen a lot of tools, but they're planning tools. They're not really operational systems to address on-site sanitation. Utilities manage the process through establishing some custom-made, self-made databases, and manually or through some kind of batch process import data for that process. But they're not operational database, they're tools. The difference of what we present today is that what we're proposing is these are systems incorporated in the utility structure, the operational systems, and they provide a smooth way and an efficient way to build capacity at the same time in the utility. And also, what I mentioned at the beginning, provide evidence-based decisions, because your data that you're collecting are from the field, are true operational data, and they're reliable. So your M&E, your monitoring and evaluation is also correct. It's not some summary information you're importing. Yes.
Oh, okay. All right. So I see Kao's hand is up.
Yeah,
You're on mute.
Yeah, thank you so much. I actually I'm so much in love with this Edams software. It's sort of giving me so much hope. As a utility, my name is Caroline Odero from Kisumu Water and Sanitation Company. We are currently using this financial software called the ERP. Though it's not really giving us much in terms of on-site sanitation systems, in terms of monitoring and even the application per se. But I'm looking at this particular one having some functionalities on OSS in terms of even say the licensing module application and all that. Currently, we are doing it manually. So my question is, how deeply different is this from this other one, and can they be integrated, or they have to work as a standalone? Like if we are currently using the ERP, if I'm to convince my management on this particular software, they'll have to purchase it and operate it differently, or there are some modules that can be integrated together?
Look, primarily, first of all, we are integrators. We're not there to replace what you have. We'll integrate to whatever systems you have. The ERP that you currently have, I don't know what's its name, but definitely we integrate with it. But the ERP is for a different job. It's not its purpose to do on-site sanitation. Nothing further than that. An ERP is an ERP. Even the word ERP implies primarily financial systems, stores, procurement, budget. It's nothing to do with OSS systems. So wherever we go, we integrate with the ERP. So we expect that an ERP will be there, and we integrate with that. So whatever investment you already done to your ERP system, that's good. We see it and we interface to it. But this is an operational system specifically to manage this process, to manage the OSS process and the fecal sludge removal. So in that sense, it will not affect your already investment, will integrate with your existing systems. And it's not an expensive solution, and it's depending on your capacity. It's something, as I said, you can implement it in 6 to 9 months or a bit more than a year, depending on your people and how committed they are. But the important thing here is we'll make the process integrated and smooth it out. And once you start using it, you will see it's much more efficient and much easier to have. You need to computerize the workflows. That's the bottom line. The whole workflow for the managing of the OSS and the fecal sludge removal needs to be computerized. And this is the quickest and fastest way to do it.
Okay, we have somebody else. Carol's hand is raised, and I believe Namaka's hand was raised earlier.
Yes, thank you, Lola. And thank you, Dr. Petros, for your presentation. If I heard you clearly at the beginning, you mentioned that in coming up with this design for the on-site sanitation system, the ERP, the Edams ERP, you work together with GIZ. I don't know if I heard that correctly. But then
Yes,
I'm just curious to know, so I'm just curious to know, how were you able to also inculcate the opinions of the utilities or municipalities who would actually use the system? Were you gathering secondary data, or did you, produce your own primary data to make sure that the actual users of the system, their opinions were considered in designing this final OSS module? Thank you.
Yes, with GIZ, we didn't work for this project. We work in the Balkans. In a slide, I didn't manage to show you because of the problem with the communication. But basically, we worked in a major asset management project in the Balkans called SIAM, Southeastern Europe Asset Management. And under that project was extremely successful. We registered 150 utilities at the end of the day, and it was one of the most successful programs of GIZ. So the experience from that program we transferred to this program here. So that's about the cooperation with GIZ, which we are strategic partners and we work till this day. But further to that, to answer the second question, who did we ask to design this system? We have experience of the last 30 years. We operate in the Southern Africa and region and in the whole of Africa for the last 35 years. We have more than 65 utilities currently users of the systems. So yes, these are the people that help us design the system. They tell us and they inform us and they tell us to do things every single day. The way we did the customer services that I showed you earlier, the CRM that I described with the different steps, it came from all our customers. They told us they want the flexibility. They want to change the workflow themselves. They told us they want a step that they want to be able to select a plot, to select a property and put that step in the process by themselves. So this is something we built over the last 20 years. It's a collective experience from all our users and our experience, because this is our work. So yes, it's something that wasn't done overnight. It wasn't done as part of a project. It was evolution over the last 20 years, what you see just now.
All right, thank you, Dr. Petros.
Yeah, thank you. I have a question, and I think this was raised multiple times, especially with regards to cost savings for Edams upgrades. I remember during your presentation, you mentioned there's a silver plan, a bronze plan, and a gold plan. So could you maybe speak more about how utilities can save costs with some of the upgrade that's been introduced? For example, your existing customers, if they want an additional module, how much will it save compared to getting, the transfer?
Look, the costing part is very, very important. Computerization initially, it doesn't save much of a cost, but once you become efficient and you start using the system and optimize your workflows, the proper use of maintenance by itself changes completely the cost equation. Perhaps one of the most difficult things is to computerize your maintenance department and computerize these functions. Because don't forget, in a utility environment, the biggest cost center is the maintenance department. So by computerizing properly the maintenance department and introducing all these systems, you manage to save considerable on your costing. First of all, you have accurate cost information. You know how long it takes for an operator to do the job. You don't know how long your team it takes to go out and a contractor to create the OSS facility. You know exactly how much it costs you to do every kind of action for the car to go there and do that activity. So you're controlling the cost of all your maintenance function. That is in essence. The second aspect here is that there are parts of what I described that they're not directly related to cost, but they seriously have a cost effect. So monitoring of the health impact, monitoring of the environmental impact, that is absolutely critical. And thirdly, something that many times is not properly emphasized, communication with the public, with the communities. You need to have, as soon as possible, these days everybody has a mobile, everybody has a portal. You need to have proper communication with the communities to be able to exchange information and get feedback. If you saw the survey I showed at the beginning, I was surprised myself that in so many countries, in so many places, they installed these OSS facilities and they never emptied. Half of them, they were never emptied. And when they asked them, why don't you empty these facilities? They said, oh, it's too high the cost, or we don't like the process, or the utility didn't come back to us. So they didn't even have proper information which of these facilities have to be emptied. And this is a health hazard. So all these issues have to be addressed. It's not just cost directly, but managing properly the processes. These are critical processes. They affect, it's a health issue. It affects water tables, it affects water resources, and they have to be managed properly one way or the other. The environmental cost, I would say, is very, very high.
Yeah, so essentially, by having systems like data systems like Edams to manage utility operations, you are one way increasing your revenue, which is also linked to several other sectors like health, sanitation, environment, and the likes. So that makes absolute sense. To my other question is also, maybe you could speak a little bit about the current data system investment for on-site sanitation model that Edams is currently working on. Could you please talk about, what that model look like and how you intend to deploy that? I know that will be starting with Lusaka. So maybe you could speak a little bit about that.
Yes, Lusaka Water Board is a long customer of ours and is a valuable customer of ours. And a lot of our recommendations to improve our systems come from Lusaka Water Board. And we have implemented, we go back long way implementing our systems in Lusaka. And lately, under the Millennium Fund, we developed an asset management program for Lusaka Water Board. So yes, it is the first site that we fine-tuning the whole OSS system, and we're going to implement it. And because they already are customers, that gives us a tremendous ability because most of the systems are already there. So in that sense, yes, it's an opportunity, and it's a valuable customer that will help us fine-tune a lot of these processes. But further to that, as a system, when it's deployed, we believe that it's being on the cloud and being on a rental basis for a utility is very smooth and very easy to implement. And one thing we always do, once we start and do the implementation, we package the implementation to form what we call capacity building program. We learned that very well, and we're very well trained from GIZ how to do curriculums, how to package the training, how to package all the implementation in a step-by-step procedure, so it can procure it in a larger scale.
Yeah,
Yes.
thank you. So basically, you're saying that with the new, data system or module development for OSS, that implies that utilities that currently have a dam system can have an additional module on their system for OSS specifically. And also for those that do not have dams right now, they could benefit from that module development by deploying that model itself. So which we also link to the some of the next steps I'll be discussing on this call. But before we go there, I would like to open the floor for any other questions from participants here today. Do you have any questions? Yes, Inamaka, go ahead.
Thank you, Barakat. Dr. Petros, seeing as AI and machine learning are the new wave right now, and Edams seems very advanced, I'm just wondering if any of these components were incorporated into the system.
Just say it again, I missed it.
I said AI and machine learning are trending at the moment, and the Edams system seems very advanced. So I was just curious to know if either of these components were integrated into the system.
Yes, not in this specific system. We use AI particularly in components of asset management and in part from calculating rehabilitation planning. There's certain sections where AI can be very useful, especially if you're involved in planning exercise or you're trying to do projections, if you try to do analysis with tools, the AI can be very useful. So in analyzing M&E results, AI can help you first of all make better projection, project the demands, project the areas where you should concentrate and implement the systems. So AI is useful, but more as a planning tool in this case. These being operational tools, we don't actually use AI as such. We computerize straightforward workflows. Perhaps what I present looks very advanced. It's not so advanced. It's down to earth, and once you use it, it's very simple. It's not something that is so difficult that it needs advanced AI or some of these processes. We reserve that more for planning purposes.
Okay, thank you.
Yeah, I saw Carl's hands up. Carl, do you want to say something?
Yeah, my final question. You see, the sanitation service provision, it's the responsibility lies largely with the water utilities, but different stakeholders are monitoring monitoring provision of these services at different levels. Like we're having the public health, the NEMA guys and even the county guys. And they're also collecting data, the monitoring data at different levels. So it forces water utilities at times to go seek for this data from them. So my question is how this system will manage, because they also have their own data collection tools. At the public health level, they have different tools that they are using to collect data and then to do reporting. How feasible or how practical is this particular system able to integrate such data from outside, like the public health data?
One of the first things we do is, if you saw the first stage one, is to see which other authorities like health department collect data and see if we can incorporate and link and regularly download or connect and exchange information with these data sets. One of the issues we have is a lot of, in the past when we looked for these sources of information, a lot of these agencies, they collect summary data. Summary data can be useful for final analysis and planning purposes, but they're not really, they already process data. They summarize data, which they're not really useful for what we're doing. We collect the operational data. But nevertheless, if we can, we link and we incorporate all this information from any other authority, or we exchange our information to these authorities. So as I said at the beginning, we're integrators. We understand that the different set of data sets, and that's part of what we're doing. We're linking different data sets, so, or different systems. So for us, it doesn't really matter. It's another database that we can link and connect information. But the nice thing about it is that by having the system on the cloud and giving the appropriate rights, all your information that you want to publish, you can publish them immediately to the right authorities.
Okay. I guess that answers your question, right, Kao?
Yeah, sure.
Okay. I see another hand up. Mwaba, please go ahead.
Okay, thank you for the good presentation. I just wanted to learn more, especially at implementation level for Lusaka Water, when it comes to FSM emptying management, especially when you highlighted that obviously now under this, you have created a module where the utility can actually start interacting with the customers and enable them to pay for these services. I just wanted to maybe find out more if that is already ready, seeing that the utility is starting to implement scheduled emptying, and did you also integrate other isolated systems that the utility already has in place, such as the sanitation permit system and so on? I'm just wondering how that will be integrated, or customers can still continue applying for those services.
You get me a bit unprepared. We haven't started anything. So
Okay.
I cannot answer this question yet. Give us another month, and I think I will be able, hopefully.
Okay. Maybe because, thank you then for that. So if you haven't yet started, maybe is it possible that you could just guide to say, if I get you correctly, so meaning you will support their utility towards implementation of these services using these modules that you have created under Edams?
We're in the middle of discussions and finalizations for doing that. So yes, but we haven't started anything yet. We're speaking with Ornam and with Dev Africa to finalize things. We haven't started yet anything.
Okay, no, thank you so much. That answers. Then we'll get in touch maybe with Dev as GIZ. Thank you.
Yes.
Yeah, just to clarify, so this is part of our project, Dev Africa Public Data System Strengthening Project. So we are currently working with Edams and Lusaka to come up with that model. So it's still in the development phase. And as soon as that is completed, stakeholders like yourself and from participants here will receive further information about that. Thank you. Grace, I see hands up. Please go ahead.
All right. Thank you very much, Barakat, and thank you so much, Dr. Petros, for the very comprehensive presentation. I just had one question regarding the integration, just like the previous caller, because we know some utilities are considering adopting the SANI tracker. That is basically to close up the accountability gap that is between utilities and the delegated functions of emptying and transportation. So I'm just wondering, have you considered that the element of integrating with any other app out there that the utility might be open to using, but then when it comes to now data management and storage, probably the utility would onboard your system. So the integration between the apps out there and your system.
Normally, any application will have its own database and its own endpoint where they collect this data. So if you're using some kind of that application and you don't want to use our application, then we'll just extract information, we'll communicate directly with this Sun Tracker application. I haven't seen it, and so I don't know it exactly. But for us, we just extract the information they collect or feed it with information, depending where they're getting from. So that's the communication we'll set up with them if you don't want to use our application.
Okay. All right. So, okay. Sorry. See another hand. Ms. Chua, please go ahead.
Right. Thank you for your presentation. It was very helpful. One question that I have is how do you integrate this with the reporting systems that the national reporting systems or the the regulators might have? Say, for example, in Lusaka's case itself, how would you integrate with their existing reporting systems? Will Edams be able to seamlessly provide data to those reporting systems, or how do you plan? Do you have any plans for further for
Yes,
that?
yes, we have. As I understand, you collect the information. The regulator collects information from the different authorities. Now, it's very easy for us to provide information to the regulator because we have all the raw data. So definitely we can connect and provide all this information. And alternatively, we can incorporate some information out of that reporting system if necessary by Lusaka requires them, so we can incorporate that data back. So connectivity to the regulator is important. It is necessary. So we will update directly that system.
Okay. All right. I think we have a lot of questions around data integration with other systems, national reporting or other tools. And I think from Dr. Petrus' response, that is possible as long as there's a database that is coming from, and that can be linked. The APIs can be linked directly to the Edams system. So thank you so much for that clarification. Yeah, so I see a question in the chat from Daniel Karanja. So the question is, for the integration, do you have standard APIs, or you have to create one that is specific to the system the utility use? So they're asking, do you have a standard API, or you have to create specific ones?
We have standard API, and we have different ways of communicating. We have first our standard API publishing a lot of our functions, and also we have routines at database level. We can very easily integrate or trigger connection to other databases.
Okay, all right. Danny, I hope that answers your questions. And I think we just take this last one from Timothy. Timothy, please go ahead.
Thank you, Barakat. My question goes on geospatial locations. I'm sorry that I joined late. Does the system provide for geolocations data collection, and is it possible? Does it visualize, or you'll have to use ArcGIS for visualization?
Yes. If you want, you can use ArcGIS, but you don't have to. We have in our systems incorporate a full GIS functionality without paying for GIS. So any of the modules is built in with GIS functionality, and you visualize and you can access the full GIS functionality automatically and see all the on-site sanitation facilities or any other layers or any other information you want to see geographically. All our implementation have geographical components, and all our systems have geographical components. In some utilities we implement, they insist of using ArcGIS. They can keep on using it. We interface to that with Esri and Arc Server, and they can publish also there any layers they like. But not necessary. You're increasing your cost considerably. Esri licenses are seriously expensive. You don't have to do that. GIS functionality is built into all the modules.
Okay. Thank you, Dr. Petrus. I think before we go to the next agenda, which is the next step, I would like us to do a quick activity. Could you please just unmute your mic, introduce your name, your organization and country, just so we know who is in the room, and that way we could also, get a sense of who we are interacting with, who is listening. So, to just, take a minute to tell us your name, your organization, and then which country you're joining us from.
Hello, everyone. My name is Namaka Ojobo. I work with DevAfric Development Advisors, and I'm joining in from Nigeria. It's a pleasure to meet everyone.
Hello, everyone. My name is Ololade Martins, and I also work with DevAfric Development Advisors. It's a pleasure to meet everyone. Thank you.
Okay. All right. I guess we are introducing ourselves internally. There's another question I would like us to take before we go. So there's a question from Promise Sambo just now. She's asking how effective has the mobile application been integrated into MMS and billing system, response and feedback from other companies. So this is specifically to Edams mobile application. How effective has it been in terms of the integration with messaging and business system?
Very effective. Not only messaging, but more important is the mechanism we have introduced to, you see all the applications and building those applications, all those are also published in the mobile applications. So the user can actually apply for his phone. Even for the billing, he can apply for new connection. He can apply for anything through the mobile. He can issue a complaint application through his mobile, and he can follow the progress. That functionality is very nice and very effective, and can be used for all kind of aspects. Like if he apply for an OSS facility, he can see if it's coming, when it's be completed, what he has to pay. So all the steps of the process, he can follow them through his mobile. So we find because there's so many mobile applications around. But most of them, you see only standard information. You get a meter reading, you see their balance, you do the payment. Very few actually go to only banking applications I've seen. They actually go into the steps of including your application process. So we do the same. Like banking, we include, you can apply through your phone. And I think that's where the power is. That's where the difficult part is, but that's what makes it so effective.
Okay, thank you. Promise, is that fine? You can just raise your hand up or thumbs up, just to make sure that is clarifying enough.
Thank you for that response. We are busy integrating it into our system, so that's why I was asking about it. Thank you for the response.
All right, thank you so much. So we'll move on to the next step, and basically the next step is just calling out some action points from our public data system strengthening project. Like you all know, DevAfric is implementing this project as part of a funded from the Bill and Melinda Gates Foundation. And our goal essentially is to strengthen public data system across utilities and municipalities in sub-Saharan Africa. And we are doing this by, multiple ways. Firstly, by conducting a landscaping of the non-sewer sanitation system across multiple countries. We've interacted with a lot of stakeholders, I think some of them on this call. And also we are doing a tool mapping. Tool mapping is essentially identifying existing data system tools that are used across, the sanitation sector. And also part of the tool mapping includes, some other activities like the learning series and also the webinar series, which is why we are here today. So if you want to get, more interesting and exciting updates about our project, please feel free to scan this code. We'll get in touch with you. We'll send you all the promotional offers, all the activities that will be coming on board. And today's webinar is our second webinar in a series. Our first webinar, which took place last month, July, focused on the NAWASCO information system. And today we are spotlighting Edams information management system. I will also be spotlighting another tool in September. More information about that tool will be communicated to everyone here. And I know it's also a very interesting opportunity for utilities, municipalities, and everyone within the sector to learn what are the practices from utilities out there, and how can you learn from those practices and use that to improve your own system, or use that as a point to, adopt a sanitation data system for your operations and also for sanitation management. Yeah, so I'm just staying on this slide just to give you a moment to scan the code. My colleague Lola has also dropped some links in the chat for you to access the learning material, for you to access the webinar page, and also see the schedule, the webinar schedule that we have in place over the next, 1 year. We have a lot of tools that will be spotlighting on a monthly basis. So please stay connected. Please feel free to reach out if you have any information, or you require any clarity, or you want to engage with us. Please feel free to reach out. We'll be in touch with you going forward. And also use this opportunity to thank our speaker, Dr. Petrus, for his outstanding presentation, and for walking us through the entire system. I know it's a lot, but this is just the start. We'll keep on communicating, more information, more opportunities with the stakeholder here. And I'm also especially happy to hear from, I think that was from Promise, which she just mentioned that our organization is looking to adopt Edams, which is, to me, which is a very good thing. And our presence here also indicates that this is a very good place to kind of explore those conversations and also see some of the offerings that are available. So thank you so much. Thank you everyone for joining. Again, we would like to apologize for the initial start issue. I hope we're able to, going forward, to be a seamless process. Thank you so much.
Thank you also from my side. Thank you.
Yeah.
Thank you, everyone. Thank you, Dr. Petrus. Do have a wonderful rest of your day, everyone.
Thank you.
Sure.